Hello everyone, this is Dr. Ryan House with Cumberland Chiropractic and Sports Medicine. We talk a lot about getting great results, about getting people better faster. That is our slogan here at this office. We talk a lot about giving each patient a specific diagnosis, like exactly what their pain is coming from. We talk about delivering specific treatment, like being on the spot, not in the area, but on the spot where that Velcro lives that's causing the person's pain. Today we're going to talk about a cool case of ankle pain where without that specificity, we would have never gotten her better. If you got a stubborn case, if you just want to get great results, stick around. This video is for you. So let's set the scene with this case. So this girl, about 14 months ago, kind of sinks her foot down in a hole. She has this classic look of a sprained ankle. That sprained ankle is not going away for her. She goes and sees an orthopedist. The orthopedist says, let's take an MRI. MRI shows, and we're looking at the outside of an ankle here. So let's turn this guy so we're seeing. MRI shows a tear of this ligament called the anterior talofibular ligament. It's got a certain percentage tear, important, we need to get that tear fixed. She has it fixed. Some rehab later, she's still suffering with this pain. So orthopedist takes another MRI, says, you know what, there's a little bit more that could be repaired, a little bit of scar tissue in this area, repairs it again, tons of physical therapy rehabilitation later, she's still suffering with her pain. She comes into us and I say, what? So I have to go through all that history. That's very important. But then I have to keep an open mind. So I asked her, okay, what makes your pain happen? She says, well, every single step. As soon as I put my heel down, every single step. So I said, okay, I'm gonna hold everything around that ankle, around this area where she's feeling her pain. As soon as she takes that step and her pain happens, I feel, and I'll highlight this guy, this peroneus brevis. I feel this peroneus brevis tug, tighten up in a huge way at the very moment where her pain happens. I poke around for a little while on that muscle and I find this terrible amount of what we call Velcro in between the fibula, which is the bone, and the tendon and the start of the belly of this peroneus brevis. That's how we got our accurate diagnosis. Step one in getting the patient better. Step one, accurate diagnosis. Step two to getting patients better faster is accurate treatment, very specific treatment. So I told that patient that long-term wear and tear leaves behind scar tissue. Scar tissue acts exactly like Velcro. You stepped in a hole and you tugged that Velcro, inflamed it, but it didn't go away. So I have to literally get my finger in between the bone and the peroneus brevis muscle. That's where that Velcro lives. If I hold that just right, the patient brings their ankle down, ankle up, ankle down, ankle up. I am separating those layers of that Velcro. 4 or 5 visits later, this patient says, man, I am done with my boot, done with my brace, my ankle feels better. I have had to move on to a low back problem because she limped around on that leg for a long time. But if you've got a stubborn problem, if you just are ready to get great results with your current pain, we treat joint, muscle, nerve problems in here. We're picky about those kind of things. Then please give us a call. We would love to help. If you like this video, give it a thumb up. If you've got a question or comment, leave it down below. If you think somebody else needs to see this video, share it on your timeline. Share it on somebody else's timeline. Tag them in this post. This has been Dr. Ryan House with Cumberland Chiropractic and Sports Medicine, where we get you better faster.